Assalamualaikum, my name is Norshira Muhammad Ghazali from the Department of Communication of International Islamic University, Malaysia. Today, I will present a research that was conducted by a group of researchers, including Dr. Shafizan, Dr. Norshira, and myself. The title of my presentation is
The Coverage of Vaccination in the Malay Newspapers, an Exploratory Study. In this section, I will explain on the background of the study. It is reported that there has been a rise in the increase of vaccine-preventable diseases in Malaysia. In February 2019, a 2-year-old boy died, believed to have been caused by diphtheria infection. A medical record revealed that the boy was not vaccinated since he was born. Following that case, there was another case reported of the same disease infecting children from different localities. Another alarming news was reported at the end of 2019 on the returning of a polio case after 27 years Malaysia being declared as a polio-free country. The polio was contracted by a 3-month-old boy in Tuaran, Sabah. These cases have caught the attention of many organizations such as health practitioners, the government, as well as the World Health Organization. Of course, there are several contributing factors to this phenomenon. Among the contributing factors include the low awareness about the importance of vaccination among parents. Secondly, is due to the easy access to social media. Thirdly, it is due to the lack of gatekeeper monitoring internet content that has allowed the anti-vaxxers to freely promote and push their ideas to the general public. It was reported as well by MCMC in 2018. 77.2% of Malaysians trusted the internet as a source of health information. That means Malaysians place credibility on the internet sources that may or may not be accurate. The rise of anti-vaccination sentiments online has its basis. Our reviews of literature revealed that anti-vaccination videos on YouTube received 32% more views and rating when compared to pro-vaccination videos. This study was conducted by Keelan in 2007. Another study by Simon et al. In 2010 reported that 60% of the online content from Facebook, Twitter, YouTube and disinformation was slanted towards the anti-vaccination movements. In an attempt to undermine the scientific validity of vaccination, the propagators will adopt several tactics that can be dishonest and fraudulent according to Qatar, as well as offering emotionally charged arguments without valid evidence, which is according to Batch 2010. Therefore, this study believes that the public needs to be given more scientific, credible, and persuasive information in order to encounter the anti-vaccination sources that are available online. It is important to note that the number of news coverage alone is not effective to help spreading the vaccination uptake. This is because the ways news media frame and present vaccines in their news stories are more important in helping change the public's understanding and thus increasing vaccine uptake. Although studies reported that positive coverage highlighting the importance of immunization can actually influence public awareness of the dangers of vaccine-preventable diseases and also promoting vaccination compliance, several studies reported otherwise. For example, as can be seen in Andrew Wakefield's case of how media's spotlight on a fraudulent scientific article had led to the increase of immunization refusal among parents in the UK. Wakefield's article in 1998 associated the MMR vaccination with the rise of autism among children. Several other studies also reported the same issues. Based on these arguments, this study has two objectives. The first one is to explore the framing of vaccination issues in the selected Malay newspapers in order to find out whether or not the media play effective roles in assuming its responsibility to correct vaccine misinformation, and secondly, to call the media for more accurate and fact-based information in covering vaccination stories. The following are the 4 research questions posed in this study. In order to answer the research questions, the study drew upon framing as the theoretical framework, as framing has been commonly used in health communication studies. Quantitative content analysis was also employed as the research method. The articles used for the study were drawn from January 2019 to September 2019, covering 9 months to provide sufficient content to identify reporting trends of 2 newspapers. In total, 131 news articles were collected from Harian Metro and Berita Harian. The unit of analysis was all articles, and the framing of vaccination was examined using different dimensions such as types of coverage, news sources, news frames. In addition, the extent of coverage was also studied from 2 angles, namely the number of news items and types of news items. The study employed the deductive approach for both news sources and news frames, which were derived from literature reviews and examination of local reporting of the vaccination issues. The content analysis conducted on the selected Malay newspapers revealed the following results, and the findings of the research will be discussed based on each research question. The first research question asks, how much do Malay newspapers cover about vaccination? From the data, it is revealed that even though anti-vaccine could be regarded as the world endemic, the news coverage on it in Malaysia is still limited. The data showed that within the sample period of 9 months, there were only a total of 131 news items on vaccination, in which 63 came from Harian Metro and another 68 came from Berita Harian. And it appeared that both newspapers gave almost the same amount of weight to the issue. Meanwhile, research question 2 asks, what are the news sources used by the newspapers when covering vaccination? From this data, it can be seen that both newspapers use official government institutions as their main source of information in their coverage of vaccination issues. For example, 82% of news reported in Berita Harian use official informants, followed closely by Harian Metro at 80%. Journalists from both media also contributed as the source of news. There is 11% and 9% for Harian Metro and Berita Harian respectively. Meanwhile, 3% of the news on vaccination for both newspapers were from institutions that conduct vaccination research. From these findings, we can say that both newspapers relied heavily on official government institutions as their source in covering vaccination issues. This also indicates that most of the journalists play a neutral role in reporting the issues where accurate, factual, and verified information are emphasized on. The third research question tried to identify the types of coverage used by the newspapers when covering vaccination. Our data revealed that 76% of vaccination coverage in Harian Metro used the news category, which is different from Berita Harian, which used the sponsored news category more prominently in covering vaccination issues, which is recorded at about 56%. Both newspapers covered stories on vaccination as an external events category, with 7% in Harian Metro and 9% in BH, Berita Harian. And based on these results also, it showed that only Harian Metro wrote special coverage on vaccination in the editorial category and none was recorded from BH. An important reality that can be derived from this finding is that when it comes to vaccination or immunization, the newspapers would treat it as news to be reported and not an issue to be highlighted, discussed, or prioritized. And even during controversial occurrences, the newspaper would only report but would not discuss in more details the consequences of that particular issue. And the final research question tried to explore how do Malaysian newspapers frame news on vaccination. From this data, it can be seen that Harian Metro recorded 55% of the use of issue focus frame, while Berita Harian recorded 77% of issue focus frame. Both newspapers used the issue focus frame by specifying incidents and crises, as well as discussing subsequent implications of vaccination. And both newspapers also frame their news by giving factual information without asserting sentiment on vaccination issues, which is in line with the principle of objectivity in journalism. And this was recorded at 31% in Harian Metro and 16% in Berita Harian. And furthermore, 9% news in Harian Metro and 7% in Berita Harian frame their coverage to support, highlight and promote governmental calls and initiatives on vaccination. And what I can derive from this data, the media did not attempt to use other types of frames that might be more useful and persuasive in containing the spread of the anti-vaccine phenomenon. We have come to the end of the presentation on the limitation and conclusions. The paper is limited in explaining how the Malaysian online newspapers cover vaccination and its preventable diseases when the COVID-19 is at the top notch of the media agenda. Future research could be suggested to compare the coverage of vaccination in relation to COVID-19 that seems to have posed much danger and casualty around the globe. In conclusion, the study found that more exposure is needed on vaccination issues in Malaysia so that it can be a national agenda in order to increase the awareness on the effect that anti-vaccination could have on public health. As such, government institutions, researchers and media practitioners should work together to inform, educate and to create awareness among the public on the importance of vaccination. The study also found that there is a need to develop a guideline to inform the media practitioners in Malaysia on how to respond to vaccination issues that are discussed and debated by social media users.
That's all from me. Thank you for your attention and Assalamualaikum.